All right, for week one, we're going to talk about time management, clinical judgment, and nursing examinations. We're going to start with time management. Students often report struggling with time management. Too often it seems there's not enough time to get everything done, especially during those crunch times. I've listed here some common concerns students often have are how much time should I plan for when studying? What's the best time? What is the appropriate balance between studies and personal life? And how do I set up a schedule and time management system that works for me? So one of your assignments for this first week is going to be to actually create a calendar for the rest of this month and next month, where you will be earmarking your life. What do you have to do? So if you're working, you put in your work hours. If you're at class or clinic or lab, you put in those hours. You want to note if it's like a skills checkoff in lab, which is like a test day in lab. You'd want to note if there's an examination, right, coming up in any of your courses. If you got kids, they got sports things going on, you want this calendar to really reflect what your obligations look like. Once you get that done, then, so it'll be for this month and next month, and there'll be written instructions later on you'll be able to see. You're going to go back and look at it, and you're going to start making in or noting when you're going to study for your courses. Because I'm sure you heard nursing is a different beast. I think I said it at your orientation. It really takes a lot of planning to be on top of things, and you can quickly feel overwhelmed if you're not managing your time well. So this is why it's one of our first assignments, is because I want you to come out the gate strong and organized and feeling in control of things. So on your calendar, you're going to look and you're going to earmark time when you're going to be studying. You're going to note what course it is. I would even recommend noting like what topics you're going to be studying, so you have a plan. With the calendar, you might want to give yourself some flexibility, maybe have an extra 4-hour window of studying that you might not use if you stay on track of things. But if you get sick, a kid gets sick, you get thrown off course, you have that bonus extra 4 window of study time that you've already budgeted that you can use. So that'll be one of the assignments that you're doing going forward. You can make the calendar however it works for you. If it's some sort of app you want to use, that's fine. If it's a paper calendar, I'm a paper person personally, that's what works for me, that's fine. Whatever it is that works for you, because it's going to be your tool to help you manage your time and stay on top of things. That's what you'll be sending in or submitting or taking a picture of and sharing with me. So think about how you're going to manage your time daily, weekly, monthly to help stay on top of life, especially now that you have nursing school as a part of that. So you probably have heard of the NCLEX. We talk about it a lot because the goal is, as going through nursing school, we're preparing you to be safe, competent nurses, registered nurses, and the NCLEX is the examination that you will take after you've successfully completed nursing school in order to get your RN license. And the purpose of the NCLEX, this high stakes test, right, is that if you pass, it's assessing you to ensure the safety of the public, basically. It's assessing you to make sure that you, the nursing school graduate, are actually a safe and competent nurse and qualified to have a registered nursing license. So that's what it is, and that's the purpose. So this slide just highlights the nursing process, as well as the NCSBN, which is like the NCLEX, the organization that puts on the NCLEX, their sort of functions of clinical judgment. So we'll look first at the bottom of the nursing process. LPNs who are taking this course are probably familiar with the nursing process. If you're a new student, this might all be foreign, and that's fine. We're sort of starting at the ground level, and we'll build up as you go through the program. You'll also hear about this in your clinical judgment course, as well as your foundations course or your LPN to RN bridge course if you're an LPN. But the 5 steps of the nursing process: assessment, analysis, planning, implementation, and evaluation. And again, this course really isn't delving in and developing those skills. That'll be more of your clinical judgment course. But I just wanted to sort of hit them a little bit, because the NCSBN, which is the organization that puts on the NCLEX, has these clinical judgment steps that correlate with the nursing process or with, there's other different clinical judgment models that your instructors might talk to you about and you could be tested on, like Tanner. In your clinical judgment course, you'll use Caputi's thinking skills, which relate back to these clinical judgment models. But a big one, because we're talking about the NCLEX and we're talking about the goal of getting through nursing schools to prepare you to be a safe, competent nurse and be able, of course, to pass the NCLEX. The NCLEX is assessing you. It recently was sort of restructured to try to get a better read on a student's clinical judgment abilities. And so these are the 6 functions of clinical judgment that the NCLEX will assess you on. So recognizing cues, what matters most for my patient? Because you could have a patient with high blood pressure, but it's not really a cardiovascular issue. Maybe they have a lot of pain that's driving up the blood pressure. So what matters most with my patient that I'm looking at? Analyzing cues, what does it mean? So the patient, a lot of pain with the BP, well, the pain's causing that elevated blood pressure. We get it. Prioritizing hypotheses, where do I start? What are my priority problems? Generating solutions, what can I do? What could a provider do? What are we going to do for the patient? Take action, what will I do? And then a big one, evaluate outcomes. Did it help? Because we're constantly assessing our patient, evaluating how they're doing, watching for trends. Are they getting better? Are they getting worse? Is what we're doing helping them or hurting them? So those are the functions of clinical judgment that the NCLEX will test you on. They'll relate back to the nursing process, or if you learn Tanner's clinical judgment model, very comparable. And they'll be reinforced throughout classroom, lab, and clinical as you progress through the program. So have you seen anything like this, any of these memes or any TikToks or whatever fancy sort of things the kiddos are using nowadays, or the adults? I am antiquated per my children because I watch Facebook Reels. But I will say that the Facebook Reels are the exact same things they see on their TikToks. So something like this, though, is a meme that you could see on social media, and a lot of nursing students will bring this up. So I selected the correct answer, but it wasn't the most correct answer. So you'll see memes of like, you know, which of these is orange? And A, B, C, D options, they're all orange. And it's sort of a joke that you'll hear made about these nursing examinations. But in reality, although it feels like every answer could be right, a multiple choice question for a nursing exam only has one correct answer. So there's only one right answer. And part of this class is going to be helping give you strategies to eliminate those distractors, the ones like they all seem like they could be right. How do we get some of those, you know, off the plate so that the correct answer is really shining for you and you're able to pick the correct answers? So although it may seem like all the answers are right, really there is only one correct answer on a nursing multiple choice question. So I already talked about, we'll go through different types of test taking strategies that'll help you be successful with these new style questions that you're going to see on nursing examinations. We're also going to go over different types of questions that you could see throughout the nursing program or on the NCLEX. If you remember, I said that the NCLEX got revamped recently to give a better assessment of a student's clinical judgment ability. And when they did that, they added some new test items. So it's not just multiple choice or select all that apply. But there'll be unfolding case studies. It will sort of look like you're looking at a patient's file. There's things which I love called bow ties, which you got to figure out the patient's condition, what you're going to be watching on them, and what interventions you'll use. So more multi-step or multifaceted sort of questions. And we'll go through and at least preview some of these different question types as we progress through this course. Reading. So the amount of material assigned to you to read, to prepare, can feel very overwhelming. So as we progress, not so much in Module 1 here, Week 1, but later on, we'll give you some tips for how to attack this reading and really make it worth your while. Because what you don't want to do is just be reading and nothing sticking. You can't remember what it is you read. We want it to be beneficial for you. So we'll give you some strategies as we progress. Some tips that you might want to try out to make reading more beneficial as you're preparing for class. Taking notes, same thing. We'll talk about different strategies you can use in preparation of class and during lecture to help make the most of the notes that you're taking. And both with reading and the note taking, it really depends on you figuring out what works for you. So what has worked in the past might not be as effective in nursing school. I always say you can look at, and this is loosely, this is just my opinion, what grade did you get in anatomy and physiology? And loosely, you'll get a letter grade below in nursing, on your nursing courses. So if you were a solid B in anatomy and physiology, you could expect to get C's in the nursing courses. And I would say the majority of students do get C's throughout the nursing program. So do not be frustrated if you feel like your grades are dropping. That is a normal thing, that you're sort of a letter grade below where you were in A&P. If you got an A in A&P, so for our high achievers out there who really just rock everything out, do not get too hard on yourself, because like I said, it's going to be very difficult to get A's in nursing school. It's not like I never see them, but it's just not as frequently as with your prereqs, your gen ed courses that you take in college. So you're going to have to give yourself a little grace, everybody, with your course grades. And just remember, as long as you're progressing forward, you're progressing in the right way. Alrighty, so studying. As you get comfortable with your peers, you might start doing some study groups. And again, just like with the reading and the note taking, you're going to have to figure out what works for you. Some people aren't fans of the study groups because they feel like too much of their time is spent on topics they don't need to review, so they don't want to do it. But it is an option. Of course, their sister, Pat Carter, who does a wonderful job with tutoring. She's never going to be the person that tells you this is going to be what's on the test, so this is what you need to study. But she will be the person who guides you while you're studying to make sure that you're focusing on the really important information, and helps you to become successful on your exams, which in turn helps you be successful on the NCLEX. With Sister Pat, I would recommend, if you're a little nervous about nursing school, it's even worth getting in touch with her early on and then realizing, I'm okay, I don't need her, versus waiting until week 12 and you're struggling and you're not sure if you're going to pass. So always try and be proactive, get that help early on, and you can stop going if you don't need the tutoring, but waiting until later in the semester can be detrimental to you passing a course. Practice questions are a big one as well. Our textbook actually has great practice questions. But I would say for foundation students, they probably aren't going to be beneficial because they're probably too hard, the practice questions that go along with the textbook. So I'm saying, like, online, you have a resource to do practice questions. But you want to keep the book and access to those online questions because they're wonderful prep for your other courses, and especially NCLEX prep. So you get done with nursing school and you got a boatload of these practice questions with rationales that are going to reinforce these test-taking strategies that you'll learn to be successful. LPN students might be able to use them a little bit sooner than the foundation students. Lastly, I just want to give you a reminder that we will use standardized testing throughout the program. We use a product called ATI that would be introduced in your foundations course or your LPN to RN bridge course at some point as the semester progresses. So know that you will be using these standardized tests in certain courses. And the product's really nice because it gives you an idea, gives you sort of a self-assessment, and lets you know where your weak areas are and what you need to remediate in order to strengthen yourself, your knowledge as a nursing student, to be successful in the program and on the NCLEX. And that really wraps up our recording for week 1. I'm excited for you all to be in the nursing program. I wish that I could be face-to-face with you and see your faces, but I'm happy that we're able to offer this course online to allow you, the student, a little flexibility with at least one of your courses. I just want to remind you, don't hesitate to reach out if you have any questions at all about nursing or any problems, school-related, life-related. Your instructors are here to help. So even if you have some questions about a clinical, even though this course doesn't have a clinical, and you got an explanation, but it's not quite clear, you can always come any sort of nursing questions, nursing school questions, problems with life, questions about policies, please know that I'm always here to help you. So don't hesitate to reach out, and I hope you guys have a wonderful, or have had a wonderful, first week of nursing school.